arena of Rasaushadhi, the usage of Rasaushadhi, and the topic would be importance of Rasaushadhi in challenging disease conditions. And I would like to invite the speaker here on stage, Dr. Mahesh Thakur, who is a distinguished Ayurvedic physician with over 3 decades of expertise in treating complex and rare diseases. Based in Mumbai, he operates 2 advanced clinics with Panchakarma facilities. He has been honored as a Rashtriya Ayurveda Guru by the Ayush Ministry and served as an honorary lecturer at Ayurveda Mahavidyalaya, Sion. Dr. Thakur has authored influential books and conducted significant research, including clinical evaluations of Ayurveda treatments. He is known for his educational initiatives, including the Chikitsa Tattva-Darshana course, which has empowered over 1,000 practitioners. His contributions have been recognized with prestigious awards, including the National Gold Medal for Best Young Practitioner. Dr. Thakur will share his rich clinical experience, as I mentioned, on importance of Rasaushadhi in challenging disease conditions. Over to you, Doctor.
Namaste, Ayubowan, respected chair, co-chair, and my esteemed colleagues, Dr. Suhas Shetty, Vaidya Mukesh Chawda, Ketan sir, and all of you gentlemen and ladies and gentlemen. My today's lecture focuses on challenging disease conditions, right? So, first of all, let us pay homage to Nagarjuna. Nalanda was the first residential university founded by Kumar Gupta in 427 CE, and it's not new for India and Sri Lanka. Like today's exchange program, this is from ages. Subjects taught included in this Nalanda University, which was this was a really place of a Buddhist ideology, and it is believed to possess 2,000 teachers and 10,000 students residing there at a time, and subjects included taught there astronomy, then philosophy, logic, metaphysics, and Ayurveda also. Most important in today's context, this our seminar conference, that the chancellor appointed by Kumar Gupta of this university was Nagarjuna, who was a Rasashastri. And so let us begin this lecture by paying homage to Rasavida. Let us come forward and not wasting much time, let us go to direct clinical experiences, right? So I want to share my case to you. A very, what you call a case of coma. Patient was in a very serious condition, and see, a 22-year-old patient, a vegetable seller, on Jan 31st, 22, involved in a severe road traffic accident at a rural place near Mumbai, and while riding to two-wheeler in the rural area, he immediately lost his consciousness and sustained with multiple injuries and abrasions on forehead and extremities, and he is immediately taken to the PSC, that is rural government clinic, and he was subsequently referred to the private hospital in the nearby city because of there are no such facilities available. Upon admission to the ICU, he was placed on ventilator and further investigated via CT scan and revealed intracranial bleed. So patient received comprehensive treatment, include broad spectrum antibiotics, anticonvulsants, antiemetics, and so on. And despite of 3-4 days intensive care, patient showed no significant change, and hence referred to a prestigious medical institute in Mumbai, that is KM Hospital. There also doctor did the same, but with a close monitoring of vital signs, multidisciplinary care, ventilator support, and still, even after 3 weeks at the KM hospital, patient conditions remained unchanged, and he is then discharged to home with a bleak prognosis and uncertain future regarding recovery. So the family faced a problem and they decided to go for the alternative solutions, and they want to explore the Ayurvedic treatment. So they required me to give a professional guidance, and then I started my treatment, and you can see and observe what happened afterwards. This was the CT scan report. This was the CT scan report of a patient. You can easily see our largest lesion was measuring 17 into 15 mm, and mild perilegional edema, mild subarachnoid hemorrhage with diffuse cerebral edema, no midline shift was observed. So when he came to me, it was 18/3/23, almost 2 months passed in the same condition, almost 2 months passed in the same condition. So our perspective, our Ayurvedic diagnosis needs Ashtavidha Pariksha, Dashavidha Pariksha, and so many other tools that we observe and we follow. So non-responsive verbal communication, that is Gyanendriya Karmahani, no eye response, no pupillar reaction, no voluntary movements of extremities, no speech, no voluntary control on excretions, only on the liquid diet with Ryle's tube, right? So this is Ashtavidha Parikshan. Jiva is Sam. Sparsha non-responsive as it is observed. Urine is also hazy. Nadi is 1-1-10. Druta Nadi. Vikrustodas Parikshan. Majjava, that is Sannyas, Jnanendriya and Karmendriya Hani. Speech loss, Grathita Mala Pravrutti. Patient is lean and malnourished, that is the Dushti of Masam Avsrotas. Samprapti, as you all know, it is a sannyas. Dosheshu madamurchaya kruta vegeshu dehinam swame upashamyati sannyasana aushadher vina. Dosheshu madamurchaya kruta vegeshu dehinam swayameva upashamyati sannyaso no aushado vina. Mada and murcha and these are kruta vegeshu dehinam swayameva upashamyati. Upashaman is swayam, but in sannyas, especially in coma, you need medicines. You need some actions. So, samprapti is like this. Mastishka abhighat, dosha prakop, accumulation of doshas in shira pranayatan, vacha sharira mana prerana vikruti, loss of function of motor organs, jnanendriya pranavayu vikruti, loss of function of sensory organs, Kashti-bhuta achetana rogi, that is unconscious body and mind, and diagnosis is sannyasa avastha. So this is a challenge, real challenge for us, and always in the practice, you should always follow a mantra, that is dare and act. You should not lose the patient. You should do something, whatever in your capacities. Either panchakarma or use of Rasaushadhis. Right? So what I have decided, what I have used, what formula I have given to this such patient, see. So what are our goals in such condition? First, restore the consciousness. Eliminate the doshas and malas from the blood, because sthana samshraya is in the rakta. So rakta prasadan is necessary. Pacification of vata dosha and improve the vital life force, that should be Ojovardhan should be there. So see what I have used. My formula is this: Shadaj Guna Balajarita Rasa Sindur 7 mg, Ropya Bhasma 10 mg, Abrak Bhasma 15 mg, Vaikranta 30, Vacha, Sariva and Yashti Madhu. Sariva and Yashti Madhu are Rakta Prasadak, right? And Vacha is for Saudhnya Prabodhana. So this is administered through Ryle's tube with Anupana of Mustadi Marmakashaya. And see what happened. A patient who is bedridden, unconscious for 2 months, rejected from the 2 institutions. One is private hospital, another is a well-known, renowned medical institution in Mumbai. So after 2 weeks, he responded to verbal communication, was able to signal about excretory urges, showed sign of recovered memory, gradual movements of hands and legs. Same medicine is continued. See the dosage forms. See the dosage: 7, 10, 5, 30, 300, 300, right? Till 33, 23, almost after 4 weeks, he started walking, could talk with a little difficulty. He started eating well. He was almost back to his normal life. Parameter is started operating mobile. So this recovery within 4 weeks with this Rasa Sindur and this combination. Of course, this is Shadguna Balijarita Rasa Sindur and made and available by Sri Dhootapapeshwar company and many other Bhasmas also. See the therapeutic rationale, why I used Abhrak, Ropya and Vaikranta along with Rasa Sindur. So Niyamati Rasesham Panchavatan. Niyaman of Panchavayu is possible with use of Rasa preparation, that is Parada preparation, that is Rasa Sindur. Ropya Bhasma is also Ayushyam Vayasthapanam Uttamam. Abhrak Bhasma is also Ayushya Agram. And Vaikrant is also Ati Rasayanasya Tat Mahagadhara. Mahagadhara is a property of Vaikranta Bhasma. So in the proper doses, it is very beneficial, and this case treated very well. That person who is a vegetable seller is now selling vegetables, riding a motorcycle and going to the marketplace to sell vegetables. So this was really a challenging case treated by this. It was not possible to give any panchakarma at that time, and results were very, very good after administering this typical formula. So Rasaujidam Shresthatvam Sadheshu Veshajam Sarvam Iritam Tattva Vedina Asadheshu Api Datavyo Rasota Shreshtham Uchyate. When asadhya conditions are there, challenging conditions are there, one must use Rasaushadhis. So let us move further and Yashada Bhasma. Any clinician aspiring to excel in the practice, some books are indispensable. One of them is Rasa Tarangini. Have you heard about Rasa Tarangini? Do you have Rasa Tarangini in your clinic? Really a very good book and very helpful for a clinician and students. Rasa Tarangini, you must keep it in your clinic. So, what Rasa Tarangini advocates about Yashada Bhasma here, that Yashadam Tuvaram Shishiram Katukam, and wonderful description about karmas of Yashada Bhasma. See, Kapha Pitta Samutita Roga Haram, Vrana Samstravarodhanam, Shleshma Kala Sankocha Krutamatam, a very defined peculiarity in the karma. Shleshma Kala Samshodha Krutamatam. So, see how I am using. Urticaria is also a commonly seen disorder. And many a times this condition can interfere the routine work of a patient, and in spite of ample of drugs are available in the modern medicine, patients are dependent on antihistaminics and many times resistant to many allopathic drugs, as well as, have you observed about Haridrakhand and Arogyavardhini using for urticaria, Shita Pitta patient? Still patients are not responding. Have you observed? In such cases, Jasad Bhasma works very well. Jasad Bhasma works very well. But according to our text, we should be able to differentiate between Shita Pitta, Udarda and Kot. Shita Pitta is Vata Kafatmak and Kotha is Pitta Kafatmak. See, this is Kot. This is Pitta Kafatmak due to vitiated doshas, Kapha and Pitta. And in Shita Pitta, Vata and Kapha. Although Madhavkara has said that another one variety is Udarda, and Madhavkara in Madhav Nidan said that Shita Pitta is due to Vata vitiation and Udarda is due to the Kapha Prakop. So, in Shita Pitta, where Vata Kapha is predominant, there you should use Yashada Bhasma with Shunthi and Triphala, and in angioedema-like conditions, very red, very hot, very itchy, in these conditions, generally these Kotha patients are many a times sufferer of Amla Pitta, and such patients are very much getting relief with Nisha, Haridra and Sariva. So these are the very nice combinations, but you should change the Sahayogi Dravyas, Yashad Bhasma with Triphala, Shunthi, which is a Katu Dravya, which is helpful in Vata Kapha conditions, and Sariva and Haridra, which are Pitta Kapha Nashak. Okay. Also in the Nadivaran, Bhagandar, Yashad Bhasma is very helpful along with the Rasamanikya. Rasamanikya is also a wonder drug. We will discuss later on this. So in Varana, you can use Nisha, Sariva and Yashti Madhu along with Yashad and Rasamanikya. Generally, we think that Praval and Moktik are Pitta Shamak, right? They are mostly used in Amla Pitta, Pittaja Shirashul, Daha, Rakta Pradar, and so many other Pitta disorders. But see the wonderful reference in the Rasa Tarangini that Mruta Bidruma Sanyuktam, Moktikam Parishilitam, Hanti Fufusa Dorbalyam, Chirakala Samudbhavam. So, combination of Praval and Moktik are the best drug of choice in Fufusa Dorbalya. What are the conditions are coming in our practices nowadays? These are, see, ILD, interstitial lung disease, and you know that interstitium is nothing but a tissue and space around air sacs, and this gets hardened, and ILD damages the tissues between alveoli and blood vessels, and then this is progressive condition. So in ILD you can use this, see, this is a cause of thickening of the interstitium, and due to the inflammation, scarring or edema, this happens. And in this condition, Pravah, Moktik and Abhrak with Sitopaladi Choorna is helpful in ILD. So as bronchiectasis, which is again a long-term condition where the airways of the lungs are widened and that build up the excessive mucus. So excessive mucus formation in bronchiectasis, many times it looks like a kaphaja kas with puffusa daurbalya, that is bronchiectasis, hardening and widening of airways. And another is ILD, that is interstitial, that is a parenchyma of lungs that get inflamed and thickening, and these tissues are, destruction of the tissues are there. At that time you should use in this thing ILD, Pravah Moktik with Abhrak Bhasma, which is a Balya. Sitopaladi is also Balya. And in bronchiectasis, you should use Shrunga Bhasma, which is a Kapha Shoshak. So Pravah Moktik Shrunga Bhasma with Talisadi Choorna is very much helpful in bronchiectasis where cough production is more excessive, and Pravah and Moktik are definitely Pitta Shamak, but they are very, very good in pacifying the kapha and vata accumulation in the respiratory systems. Another thing is allergic rhinitis. Mumbai we are facing so many of patients of allergic rhinitis, like in Colombo also maybe. And this is a common disorder, seasonal and perennial. And in this condition also, Abhrak Bhasma with Samir Pandak. See the quantity of dosage of medicines. Abhrak Bhasma 50 milligram, Samir Pandak is only 25 milligram with Sitopaladi and Yashti Madhu. This is a very good combination for purulent nasal discharge, sneezing, nasal congestion, that is Nasa Naha. This is in Vataja variety of allergic rhinitis, and in thick mucus discharge, heaviness of the head, feverish feeling, in such condition, Rasasindur, Godanti Bhasma, Trikatu Choorna and Talisadi Choorna. So Samir Pandak in Vataja variety and Rasasindur in Kaphaja variety is very helpful. Only in the allergic rhinitis, but you can easily distinguish with the symptoms that how the vata vitiated and causing allergic rhinitis, and how the kapha is more and causing allergic rhinitis. So allergic rhinitis may be due to the pollution in the these cities, but still the doshas are also important and they play main role in the symptoms. Rasamanikya. So Rasamanikya is also Vividani cha Kushtani Tatha Nadi Varanam Harit. We all know that Rasamanikya is prepared by heating a Shuddha Hartal powder, which is sandwiched between Abhrak Patra, and it offers beneficial effects in management of wounds, boils, eczema, rashes, leukoderma, fistula, vatarakta. It is really yoga vahi dravya. Rasamanikya is a yoga vahi dravya. So in Vataja Kushtha, there is a Tvak Sankocha, Shofa. In Pittaja, there is a Daha, Paka. In Kaphaja Kushtha, there is a itching, pruritus, discharge, purulent discharge many times. So you can use like this. This is a typical picture of Vataja Kushtha. You can use Rasamanikya with Abhrak Bhasma. in such conditions. See, this is a very peculiar picture of Pittaja Kushtha. You can see the redness. You can observe patient often complains of burning sensation. In such condition with Swarnamakshik and Praval, so associated Bhasma you should select. Why Suvarnamakshik? Because Suvarnamakshik is a Kapha Pitta Ghana. Charaka has also said Saptadasha Kushthaghati Makshika Dhatuscha Mutrena. So Makshika has his own capacity to act upon Saptadasha Kushtha. So Suvarnamakshik is also a drug of choice in skin disorders, but with Rasamanikya 25 mg and Suvarnamakshik 125 mg with Pravala Bhasma, they are Pitta Shamak. And in Kafaja variety like this, you can use Rasamanikya with Vanga and Yashad Bhasma. So you have to just give co-passenger to a Yogavahi Dravya. Right? For Kafaja, Vanga and Yashad. For Pittaja, Swarnamakshik and Praval. And for Vataja, Abrak Bhasma. This is the beauty of Ayurvedic practice in just using and changing the associated dravyas. You can change the Yogavahi dravya to a particular certain doshas to pacify. This is the case of a patient who is a bedridden, and due to his operation of a spinal cord discectomy and failure of operation, he was bedridden for 3 to 4 years. And his mother used to come to me for common ailments like cough and cold, fever, diarrhea, dysentery, acidity, and so on. Once she landed up with this photograph of a patient of ulcers on the phalanges of leg, and very difficult to administer any panchakarma, that because patient was bedridden, so no virechan or any raktamokshan was administered, though the Sushruta said Sadhya Shuddhakar Shariranam Prashamam Yantihi Vranaha. So panchakarmas are must for the Vran healing. But here again, use of Rasaushadhi, how it is helpful. See, this is the Vran, and given treatment is Rasamanikya 60 mg, Vanga Bhasma 60 mg, Yashad Bhasma 60 mg with Kushtagna Choorna 5 gram, 1 dose 3 times in a day for 5 days only. I thought that let us see what happens, and then we will give Vranaropak Tel, wound healing ointments, wound healing oils afterwards in the next visit of his mother. So I decided just take this medicine, let us see after 5 days. She came after 5 days with this picture. This is what the beauty of Rasamanikya and Yashad Bhasma in the proper dose if you used. No wound healing ointment, oil, lepam were given, not even any of the panchakarma done. Still with this effective medicines only you can get this type of wonderful results. Rasasindur. There are many combinations of mercury in Ayurved, Kajjali and others so on, but Rasasindur is always excellent, superior than others. Why? See a very marvelous shlok, very important. One must see, one must look at this slide. What Rasatarinikar said, Sphitatam Dantaveshtam Mukhapakam Kshatadikam Lalastravam Pradaham Vikaran Idrushan Darunan Paradothitan. Because of use of mercury, this type of effects, ill effects you can get in the patients. But न जातु प्रकरोत्योषो एषः rasaha sindur saujnaka. By using of rasa sindur, you won't get such type of any ill effects with even proper dose of rasa sindur only. So that is what the shreshtastva of rasa sindur. So one must use rasa sindur. Rasa sindur is best for the lower respiratory tract infections. Rasa sindur shrunga with sitopaladi. This is very common prescription, common formula in all over India. Doctors are using. COVID-19 pandemic, right? 2019, almost 213 countries affected by COVID-19 pandemic, and we have seen. You have also seen the COVID-19 patients, right? Coronavirus affected patients with mild infection also and critical condition also with severe infection. Severe infection cause acute respiratory distress with coagulation cascade and multi-organ failure and very critical patient. And we were very lucky to use Ayurvedic preparations in ICU, in multi-speciality hospitals, through Ryle's tube to such patients. And what happened, you see, you can correlate this with a Sandhipatik Jwar. And Sandhipatik Jwar, especially, it is mentioned by Bhav Prakash and other granthas also, that is Abhinyasa Jwar. And if you see the Abhinyasa Jwar, it is clearly mentioned, Trayascha Kupita Doshas Urasthroto Anuga Vrisham, that all these three doshas travel to Ura, that is respiratory system, in the lungs, Bhrisham, and Ama Vibadda Grathita Buddhi Indriyo Mano Anugaha Janeti Mahaghoram Abhinyasam Nashta Chesto Na Kangshate. It is very difficult for a patient to come out from this condition. So Prastabda Gatra Avagmi, patient cannot speak. So many times you observed in the ICU, patient cannot speak because of the severe respiratory distress, particularly in COVID-19. And typical, the same picture is written under the Abhinyasa Jwar, which is a variety of Sandhipatik Jwar. So, see, the best drug administered at that time was Samir Pannagaras. Why? Because Sannipate Kafonmade Sandhibande Kafamaye Nagavalya Daleneva Bhakshe Gunjikamitam. So Samir Pannag is a very good. Why? It is should be used in a Sannipat and especially Kafaja Sannipat. Sannipate Kafe Unmade. Sannipate Kafo Unmade. So it is for Kafaja variety of Sandhipatik Jwar, which is easily comparable with the Abhinyas Jwar, just as showed you the reference. So COVID symptoms, Dorbalya, Gandhanash, Aruchi, mild fever, and this medicine combination was used. See the dosage, where from previous slides, doses were 30 milligram, 60 milligram, 25 milligram like. But in these conditions, see Samir Pannak 300 milligram. You must use this. See, but this drug, this combination used for 3 days and for most of the 10 days, not more than that. But many patients who were severely affected by this COVID SARS-19 infection and admitted in the ICU, and they said that patient may die at any time, you can try another options, and that condition we give Ayurvedic medicines. This formula contains Trailokya Chintamani, Vaikranta Bhasma, Yashad Bhasma, Abhrak, Samir Pannak, with Chausashta Pippali, Vachat, Haridra and Sitopaladi Choorna. And this particular Mishran is for 3 days, and consecutive 3 to 6 or 9 days, so many patients relieved from the such acute condition. Another thing is Raynaud's phenomena. Have you observed such patients in your clinic? Raynaud's phenomena. And Raynaud's phenomena is very common in the patients of scleroderma and lupus patients, systemic lupus erythematosus. I have seen in my lifetime and got opportunity to treat patients, 3 to 4 patients in my 30 years practice, a classic Raynaud's phenomena. In such patients, they get numbness, coldness of the extremities and severe pain, and generally there would be a lesion, wounds afterwards if patient ignored the condition, and there is no such good treatment for such conditions in even modern science. The best drug of choice in this is Suvarnamakardhvaj. I have used Suvarnamakardhvaj in Raynaud's phenomena many a times, should not say 3-4 patients I have seen, and those 3-4 patients treated very well, got benefit out of it, and Suvarnamakardhvaj should be used in such condition with Raupya Bhasma. Suvarnamakardhvaj is a good vasodilator. It supplies this vessels, arteries to such toes, or the toes are obliterated, the supply is stopped, and such conditions, Suvarnamakardhvaj with Raupya Bhasma, Sariva, Haridra and Guduchi. The Sariva, Haridra and Guduchi are Rakta Prasadak. So Suvarnamakardhvaj with Raupya is very helpful in such conditions. Now let us come to another challenge, that is diabetic retinopathy. And 2 conditions are there, non-proliferative retinopathy and proliferative. Initially the retina capillary microangiopathy is there. Then in proliferative retinopathy, severe ischemia, hypoxia, macular edema, and because of macular edema there is a leakage, exudate and hemorrhage and retinal detachment. So retinal detachment and glaucoma are the common complications of this diabetic retinopathy. You get pictures, retina scan, many times patient come with that reports. In modern medicine, treatment is very costly. In Ayurved, yes, we can definitely do something. See, there are stages, and patient from mild non-proliferative diabetic retinopathy towards proliferative diabetic retinopathy within, say, of 1 year or 2 years, every patient travels in that particular zone to have a retinal detachment or some other complications. In this condition, see Suvarnamalini Vasanta. Why Suvarnamalini Vasanta? Suvarnamalini Vasanta, we know that this drug is Jwarahara, right? This is Ojo Vardhaka, this is Rasayana, this is immunomodulator and whatnot. Because of presence of Yashada and Suvarna with Hingul and Moktik in this particular drug formulation, right? Suvarnamalini Vasanta. And Bhavana is of the trituration made in the Navneet and Nimburas, Suvarnamalini Vasanta. Why the Vasanta term here implies? The term implies here is a Vasanta Rutu, which resembles the greenery or the rasayan or regeneration. It's the same in the body, like in Vasanta Rutu. Blossoming of flowers is there in the Vasanta Rutu. The same, the tissue regeneration in our body. So Suvarnamalini Vasanta name has given. See, the different approach, when you study Kalpa, you get a different approach. What is that? See the next slide. Rationale of Suvarnamalini Vasanta as a Netriya. If you go to the references of all contents, ingredients of Suvarnamalini Vasanta, surprisingly, all of them from Navnita to Suvarna, Moktik, Yashada, Maricha, all of them are Netriya. All of them are Netriya. Maricha is Chakshushya, Yashada is Nayanamaya Nashakam, butter or the Navnit is a Akshirogajit, Suvarna is a Paramanetria, Moktik is a Netriam Varnam Chakirtitam, Hingula is also Lochana Mayaharam. So, in diabetic retinopathy, see in ophthalmic diseases, when there is a hemorrhagic condition, one should use Vasanta Kusumakar Ras with Suvarna Makshik, and when the retinal edema or with systemic debility and other proliferative, the third and fourth stage of this diabetic retinopathy, one must use Suvarna Malini Vasanta with Abrak Bhasma, and Anupan should be selected is Jivantyadi Ghrutam, which is again a Netriya Ghruta. So along with Jivantyadi Ghruta, you can use Vasanta Kusumakar in hemorrhagic diabetic retinopathy, and in the macular edema or in the developing glaucoma or another systemic debility or to reduce the retinal edema, you must use Suvarna Malini Vasanta. So last slide is about Suvarna. Again, Suvarna is also Vrushya, Jivaniya, anti-cancer, anti-viral and what not. Market is of Suvarna. You can cover all the diseases with Suvarna Bhasma. But see these references. Asti shosham tu asti shotham, asti gatam kshatam, asti vakratam, daruna asti pidam chanashayet. So Suvarna Bhasma is a different, altogether different reference on asti. When the patient of asti strotas comes to your clinic, you also think, many times you think about Shrunga Bhasma and calcium preparations in Ayurved, and otherwise Asti Shrunkala, Arjun, Lakshadi Gugu and what not. But in some cases, like osteogenesis imperfecta, or there are many cases, osteomalacia, in the such challenging and rare cases, one should remember Suvarna Bhasma, God of small things. Who wants to use Rasakalpa, Bhasmas in the practice? They should have what? One is Rasatarangini in the clinic. Another one is, this is electronic weighing balance. In my clinic, this electronic weighing balance is there. I measured 30 milligram of Suvarnam Rasamanikya, 10 milligram of Rasasindur, 30 milligram of Ropya Bhasma, whatever mixture I want to do, I measure it and then I equally distribute it and give it to the patient. Without measuring, I am not giving any combination from my clinic. So this is must God of small things you should have in your clinic. So thank you once again, and I am very much grateful and thankful to all Dhootapapeshwar team to giving me opportunity to share my clinical experiences with you. Thank you once again.
Thank you, Dr. Thakur, for the knowledge you shared with us with your expertise over the years. And we would like to invite you back on stage to accept this small token of appreciation presented to you on behalf of taking part today at this forum at Sri Dhootapapeshwar Limited, organizing this Rasashastra Sambhasha for the 7th consecutive year. I would like to invite one of our co-chairs to present this token of appreciation, Dr. Nirasha Gunaratna.